Hi, I'm Tony Gawaldo with Arthrex Vet Systems, and I'm here with Dr. Helen Newman, the Director of Veterinary Transplant Services, a professional veterinary tissue bank. Arthrex is partnering with VTS to offer you new biologics products. You'll learn more about these products throughout this series of podcasts. We'll begin with a look at what Veterinary Transplant Services does and how it might help you in your practice. Welcome, Helen.
Thank you very much, Tony.
So, Helen, can you tell us a little bit about VTS and how it got started in the veterinary market?
Sure. VTS has been around for 20 years now. We're starting our 21st year. And back in 1996, I was invited by a leader in veterinary orthopedics, Ken Sinibaldi, to get involved in providing bone grafts for veterinary patients. At the time, I was in charge of a human tissue bank. And we were making bone grafts and tendons and other kinds of grafts that are used for transplant in humans. It was part of the Puget Sound Blood Center in Seattle. And there was a technician in my lab who had a dog with bad hips. And so he ended up finding Dr. Sinibaldi. And, it's history from there. Basically, I got interested because the bone grafts being used in my technician's dog were of interest. And so I talked with Dr. Sinibaldi, and he said, you got to start a veterinary version of what you do at that human tissue bank because we have dogs with bad hips and bad knees and gunshot wounds and hit by cars. And I'm one of the few vets who banks his own bone. We could really use some help. That was kind of the light bulb moment for me, knowing how to make all of these grafts and what was involved in that got me inspired to try to fill a niche and help in the veterinary community.
That's excellent. So you started with helping a friend's animal.
Yeah, absolutely.
That's great. How do you get donors for your program?
Everybody knows that when you sign your driver's license, you can make a choice about whether you want to be an organ or a tissue donor. And we essentially have a similar program here in our local area, but what's more focused. We work with a series of what we call donor partner hospitals. And we go to the hospitals and give donor lectures. So we educate the veterinarians who might be in a position to be dealing with a family whose dog has just been hit by a car and maybe doesn't survive in the emergency room, or a dog that's maybe being euthanized for intractable aggression. They've bitten someone, they've had treatment, they've had therapies, they've had behavioral modifications, and nothing seems to be working. And sometimes the families have to make a difficult decision to put a dog to sleep. The veterinarian is always the interface between the family and veterinary transplant services. And if the veterinarian feels that hearing something about tissue donation might be helpful for that family to get through the grieving process, they'll bring this up as part of the aftercare discussion. So they may say, are you interested in hearing about tissue banking? We work with one of the only tissue banks in the world, and they can recover grafts that can be useful to help other animals. Now, oftentimes, veterinarians are asked by owners of pets, who are faced with the loss of their pet, isn't there something that can be done? People understand a lot about transplants, and many times vets tell us they're asked. Owners say, gosh, isn't there something that could be done, to help other animals? And so in that situation, the veterinarian will tell them about VTS, and then they will also call us to say that there's a family that's interested and give us medical history and the other information we need. And I just want to take 2 seconds to say that we talk with a family directly after that. We obtain an written informed consent from them so they understand what we're doing. We also take samples. The family can spend time with their pet through the grieving process because we only recover tissue grafts after the heart has stopped beating, and we have up to 12 hours to do that. So families can spend all the time they want with their pet to say their goodbyes, and then we can take their pet's body to our facility to recover all of the grafts that can be used to help other animals. So that's what we do. We can provide a private cremation if they're interested. And so for the family, there's nothing else involved. We don't pay them, and everything is as they might expect. So then they're free to call us with any questions. So they come away with some small positive thing that knowing that their pet's loss has gone on to help some other animals in many ways. So that's essentially how the donor program works.
Yeah, that's excellent. So once you have a pet that is donated and they are received in your facility, how are these products recovered and manufactured? Is it done similar to the way they do it in human tissue banks?
Yes, that's actually identical to how it is done in human tissue banks. So we will bring the pet's body to our facility, and we have actually a laminar airflow clean room. So it's about 1,000 times cleaner than a standard operating room. There are HEPA filters in the ceiling, and so it's basically standing in a sterile air shower. And so we'll recover tissues in a sterile surgical procedure, and then they all get cultured for microbes to make sure that there's no circulating, bacteria, or that they haven't gotten contaminated in some way. Those microcultures are 14-day cultures. And during that 14-day period, we also collect medical history about the donor. We get their vaccination records. We send samples off for testing. We test for over 30 different viruses and infectious agents using PCR, which is a really sophisticated way of looking for viruses, the presence of viruses. And so all of this testing goes on while we're waiting for the microbiology. Once that happens, then we can, if that's all reviewed and acceptable, then we can go on and process the tissues. And again, it's just like a human tissue bank. So we'll take the bone graft and clean the bone, shape them, process them, and make them into different sizes and shapes and conformations that veterinarians then can use in their surgeries. It's all a sterile procedure, and again, processed in that laminar airflow clean room from start to finish and cultured along the way. And then they're individually packaged and labeled and shipped. We can trace every individual product that we've ever made from the donor all the way through all of the processing steps to the recipient, even because of all of the labeling and traceability that we do. So it's very much like a human tissue bank.
Very good. So once the donor is received, the grafts are processed and put into inventory. When a surgeon is looking for a particular allograft for a patient, do they need to be concerned about a donor match or rejection when selecting a particular allograft?
That's a very good question, Tony, and a lot of people either ask that question or wish they'd asked that question. It would be true if you were transplanting hearts and livers and kidneys, because those are living cells and living organs, and they come with a load of cells, that are representative of the donor. But with things like bone grafts and tendons and corneas, our processing methods are designed to remove all of the living cells. And so there aren't antigens that come from the donor remaining in the bone grafts. And the same is true in human tissue banking. So when someone calls to order a bone graft from a human tissue bank, there's no matching required, and no immune response is expected or found. And so blood group matching or even blood type matching isn't required for things like bone grafts, tendons, and corneas. It's simply because there's no living cells or cell fragments.
All the donor cells have been removed from the tissue, and it's acting as a scaffolding at that point?
The healing mechanisms for bone are that when bone is living and creating, and developing, bone cells will synthesize bone growth factors, a whole variety. At least there are more than 25 that we know of that are secreted and sequestered in the matrix of bone. And then they're hidden basically by the minerals, the mineral coating of bone, so that they're not active. But when there's a trauma or a damage, cells come in and resorb the minerals, and that exposes the growth factors that are hidden in that bone matrix. Well, the same is true with the bone allografts. The growth factors are hidden in the bone matrix, and they don't rely on having living cells to be active. So we take advantage of that when we create bone grafts. And so we process these to remove all the cellular elements, but retain all of these growth factors. And so the growth factors are built into and are an intrinsic part of the bone graft matrix. So when they're transplanted, they can be active right away. So it's more than just a scaffold. It's a scaffold plus growth factors.
Okay. When we started to work together, what would you think would be the best thing about VTS and Arthrex working together?
Well, I think that VTS and Arthrex are great partners because we both have backgrounds in sophisticated products for the human market. And we translate those advancements into veterinary applications. And I think we both have that as a singular goal. On the human side, Arthrex is very familiar in working with human tissue banks, and they recognize the importance of the interaction. So between companies like Arthrex that can provide these biologic products, but often those work best or well with allograft products. And so Arthrex's biologics and surgery expertise and VTS's wide-ranging tissue banking expertise allows us both to kind of synergistically develop and provide novel biologic products that are tailored very specifically for the veterinary market.
Thank you, Helen, for spending time with us today, and especially for sharing your expertise in the Arthrex goal of helping surgeons treat their patients better. If you're a veterinarian interested in learning more, please get in touch with us via email at csvs@arthrex.com or call our customer service department at 1-888-215-3740. If you're interested in more technical questions, feel free to call Dr. Newman directly at VTS, telephone number 253-520-0771. On our next podcast, we'll be discussing OrthoMix, a natural real bone allograft for animals. Thanks for listening, everyone.